So thanks for joining everyone today. Welcome to the Society of Thoracic Surgeons General Thoracic Surgery Database monthly webinar. Today, Tuesday or Wednesday? It's Wednesday, November the 9th, 2022. So thanks everyone for joining. Let's see here on the call with me today, who do we have? From the STS, we have myself and Carol Crone and Sydney Clinton. And from our core group, we have Ruth Raleigh and Katie Lothrop. And then from IQVIA, we have Jean joining us today. So thanks everyone for joining. I'm just going to provide a brief STS update, and Ruth just has some brief a few education slides. We don't have a lot of new information today. And then we'll finish things up with your user feedback. If you have any questions, please be sure to put those into the Q&A and not the chat. And if also we do have the raised hand function enabled. So if you'd like to raise your hand and just ask your question, you're welcome to do that as well. Just again, make sure your microphone's enabled on your end. All right, so let's go ahead and jump in with our STS updates. The November training manual is going to be posted by the end of this week. So that will go out to Kasha and our marketing team either today or tomorrow, and she'll have that posted for us by the end of this week. The fall 22 harvest is actually out of analysis, and results are expected. We're expected to have those available to you by the end of this week. We're currently in the user acceptance testing phase of that. So we are looking over the results internally within the platform. And as long as we everything looks good to go, those results will be available to you all by the end of this week. Of course, once those results are available and live in the platform, we will send out a communication to you all, letting you know that the results are available and that they can be accessed within the IQVIA platform. With that being said, the spring 23 harvest, as you are aware, is currently underway due to the continuous harvest process. The spring and fall 23 harvest close dates will be posted out on the STS website very soon. We have starting to finalize those internally and just waiting on approval from everyone. And just know that the spring and fall 23 harvest close dates will continue to follow our previous harvest schedules. So the spring 23 harvest is set to close in early March. And the same for the fall 23, we're looking to close that in early September. So those final dates will be posted hopefully by the end of this week, definitely by the first of next week. So again, the spring 23 harvest, you can plan on that closing 1st of March, and then the fall 23 look for that to close in early September. Just a reminder that the spring 23 reporting period does include the OR surgery dates of January 1, 2020 through 12/31 of 2022. And then our fall 23 reporting period will include OR dates of July 1, 2020 through 6/30 of 2023. A quick audit update from Emily from our audit team. The 2022 audit has been completed. So for those sites that were selected and included in the 2022 audit, those final audit results will be sent to you this week, early next week. So Emily is working on getting those final audit reports and results completed, and she'll be sending those out to those sites again later this week and early next week. So look for those to be coming to you shortly. Also, some very important news, and I'm sure most of you have heard that or received the communication last week. I believe it was sent out on Wednesday, I think, of last week. But we are announcing the GTSD, the General Thoracic Surgery Database, and the U.S. News Transparency Credit. So U.S. News did recently announce that it has decided to create a new transparency measure to be used in its best hospital rankings. The measure will be based on whether a hospital elects to publicly report its lobectomy outcomes on the GTSD public reporting website as of February 12 of 2023. Detailed information regarding this GTSD and U.S. News initiative is available out on the U.S. News blog post, and there is a link to that. And there was also a link in the communication that was sent last week. To ensure all of our participants have the opportunity to qualify for this new transparency credit, we have scheduled an additional public reporting website update that will use the results from the fall 22 harvest. Again, OR dates of July 1, 2019 through June 30th of 2022. These harvest results are scheduled to be released, again, like as I just stated in the platform, actually hopefully by the end of this week. So again, more information, we will let you know when those results are available. We will send that communication out to you, but please look for those to be available by the end of this week or at the latest very early next week. If you already participate in public reporting, please know that you do not need to submit a new consent form unless you are making changes to your current form that is on file with STS. If you are not currently enrolled in public reporting and you would like to be included in the next update, you do have the opportunity to get a consent form in that must be in and submitted to STS by Wednesday, December the 14th. Again, the final date to get those consent forms in, if you are not currently consented, is Wednesday, December the 14th. If you're not sure if you're currently enrolled, you can confirm your current enrollment status. Just email us at this address here, publicreporting@sts.org, and Sydney will be able to answer all of your questions. Since this announcement has been released, we've gotten a few questions about how U.S. News is going to utilize this transparency credit, the methodology behind that. For those types of questions regarding how U.S. News plans to use this information, you would need to reach out to U.S. News directly, and we've provided a contact here for the U.S. News Best Hospitals team. Please reach out to them via this email address, bhmethodology@usnews.com. STS isn't, we're not able to answer any questions regarding how U.S. News plans to use this information. So again, if you have questions regarding the transparency credit itself, please contact U.S. News directly. This very exciting information. Just a big kudos to our GTSD task force leader, Dr. Chris Cedar, the public reporting task force team, Jane, Sydney, everyone. Great work. This is very exciting, and we're very, very excited about this. So please, if you'd like more information, please reach out to us at publicreporting@sts.org. Also, I just wanted to give a quick thank you to everyone that attended AQO and to all of our presenters, our core group members. Thank you to everyone that attended AQO this year. It was so great to see you all in person. For those of you that were not able to be there in person, all of those live sessions that, as you're aware, were recorded and will be available for viewing by mid-November. Emily has indicated that she is hoping to have all of the recordings of all of the live sessions available on the AQO platform by the 18th of November. So once all of those sessions are available, we will send out an email to you all letting you know that the content is available. Also, all content, the on-demand and the recorded sessions from the live sessions will be available on the platform until October the 28th of 2023. As we've talked about before, for those virtual attendees, those that were not able to make it in person, we are having an AQO Hot Topics webinar that will be held in January. We will be bringing back our speakers in order for our virtual attendees, as well as our live attendees that may have questions after the conference. So we will be bringing our speakers back to address any questions that you may have. So more information about our Hot Topics webinar will be coming. I think we're looking around, I think it's the second week of January. I think, Carol, I think that's what we're looking at. So again, more information regarding the exact dates for that Hot Topics webinar will be coming out. Continuing education credit attendees, just a reminder, attendees must watch all on-demand and live content, then evaluate all presentations. This must be done at the same time. Certificates will be processed once a month based on the prior month's completions, and just the deadline to complete all of your evaluations and claim credit is January the 28th of 2023. So if you have any questions about continuing education or the virtual platform, please feel free to reach out to us and we can help you with any of those. So, but again, just a quick thank you to all of our presenters, our surgeon leaders, our core group members. Thank you all. We couldn't do this without you. So we look forward to AQO in 2023. That's all I have from the STS side of things in terms of updates. So next I'm going to turn things over to Ruth for our education portion. Ruth.
Thanks, Leanne. Just a few quick education updates today that will be published in the November training manual. 2 of them pertain to sequence 1620, which is clinical staging methods. A specific time frame has replaced the very general guideline in the training manual for sequence 1620, which was based on the task force evaluating published data regarding median time from diagnosis to treatment for non-small cell lung cancers. So now, in order to include clinicals or to capture code clinical staging for sequence 1620, it has to be performed within 4 months of any treatment for the same disease, not just surgery. So for example, if you have a patient who has a CT, brain MRI, PET scan, and then has chemotherapy that starts within 2 months, and then there's surgery 3 or 4 months later. The surgery was more than 4 months after the clinical staging, but they had treatment. The chemo, the neoadjuvant therapy started within 4 months, so you could capture the clinical staging in that instance. Or of course, the more common scenario where your patient just has clinical staging and then goes directly to the OR without any neoadjuvant treatments. That could be captured as long as it's within 4 months. The second clarification to sequence 1620 pertains only to invasive mediastinal staging being performed. This has been a challenging section. There's been a lot of dialogue internally in the STS about this sequence. Please know that all of the feedback that was sent was extremely valuable and considered. So ultimately, the decision has been made to remove the April 2022 clarification regarding N2 nodes not being, so if only N2 nodes were sampled, the EBIS could not be counted. We now are to capture EBIS in all instances where the EBIS is performed. This includes EBIS without a biopsy, EBIS with a non-diagnostic biopsy, meaning there were no lymphocytes in your sample, and EBIS sampling of only N1 nodes. And then the last clarification to the training manual for November that I'm going to touch on, there are many more than this, but these are sort of 3 highlights. Sequence 4140, unexpected escalation of care. So we had to make a determination on what to do with patients who have an unexpected event in the OR, which then contributes to an unexpected admission to an ICU or PCU from the OR. So the guidance is that if a patient is unexpectedly admitted to an ICU or PCU from the OR due to unexpected intraoperative events, then you would capture that as an unexpected escalation of care. If the data manager notices a post-op ICU PCU admission that is not the norm for the procedure type performed, then you should discuss that with your surgeon to make that final determination on whether that was expected or not, if it's not, you know, glaringly obvious from the notes. So for example, at my institution, almost all lobectomy patients go to an intermediate care unit post-operatively. If the patient is planned to go to the ICU for some history, like, you know, reasons related to the patient's H&P, then that's always indicated in the pre-op H&P that the plan is for the patient to be admitted to the ICU. In rare instances, something happens intraoperatively and a patient that was planned to go to the PCU goes to the ICU, and so those would now be captured in 4140. And that is the extent of my education updates.
Thanks, Ruth. Appreciate it. We do not have any updates from IQVIA, so nothing new here. Just know if you've submitted tickets, they are currently under review, and the IQVIA support team will follow up. If you do have any questions, I believe Jean is on the call, but if you have an outstanding ticket or need an update, just please feel free to put that into the chat, into the Q&A, and I think Jean and her team could take a look into that and follow up with you directly. My contact information here, you all are familiar with. Again, just feel free to reach out to me if you have any questions or concerns. Database operational questions, reach out to us at stsdb@sts.org. upcoming GTSD webinars. Our next monthly webinar is scheduled for December the 14th at 1:30 Central. Our next user group call, we would have had one on November the 23rd, but that one has been canceled. To be completely honest, I will be busy cooking all day on that Wednesday. So November the 23rd, that call is canceled due to the Thanksgiving holiday. And then our next user group call is not scheduled until December the 28th, just after Christmas. So we may have to reevaluate that date as well, but we'll provide updates obviously on if any of these dates change moving forward. So our next monthly webinar again is December 14th, and our next user group call is scheduled December to the 28th. But in the meantime, if you have any questions, please email me directly. If you have any clinical questions or anything like that, please submit those via the FAQ. All right, that's what I have. That's all that we have today. I do see some questions, so let's go ahead and tackle those. Ruth, I know Beth has submitted some questions, but I think, Beth, if you've not submitted these via the clinical question form, if you could submit those. If there are outstanding questions, we have our core group call on Friday. So I know Ruth has a list of questions that will be addressed by our surgeons and the core group members on Friday. So we'll be getting back to you, but I'm just taking a quick glance. But Ruth, I think you would prefer to just have these submitted via FAQ, if
Beth
not
has
already done
submitted,
so.
Beth has submitted most of these via FAQ,
Okay.
but I know that your sequence 4200 question is definitely on my list to take to the core group on Friday. Just in general, some guidance for the group on 3670. So the training manual indicates reinsertion of pigtail catheters at the bedside, et cetera, are not intended to be captured in sequence 3670. It's in the training manual. So I can add some additional examples there to provide clarity for the whole group, if that would be helpful. But I do have your questions, Beth, and we'll get back to you. And then I think there's a question for me. Can I skip ahead, Leanne?
Oh, yeah, go ahead. Yeah,
Joseph's
sure.
question. So Joseph has a question regarding sequence 3970. So if you look up in the training manual under 3660, it says that postoperative events at any time during the hospital visit, regardless of length of stay, and or events that occur within 30 days of surgery if discharged from the hospital. So your question about postoperative PRBCs would be for the entire length of stay of the hospitalization unless your patient has gone home. And then post-op RBCs are one of those sequences that if you look in the clarifications to sequence 3660 would not be captured for a readmit. It's only for the index admission. So I think that the answers you're looking for are in the training manual. It's just up under 3660. So I recommend checking there.
Yeah, I can. Yeah, hold on. I can pull it over, Ruth. Are you typing this here?
Yep. So if you go up and right there, the definition has some really good information. And then there are some FAQs in March. And I think I copied and pasted that same sort of comment under each one of the sequences that are only for the index admission. And if I missed one, somebody feel free to let me know. My intent was to post it under every one of them.
Great. Thanks. Oops, okay, you're welcome. Joseph says thank you.
Yeah, you're welcome. Mindy asked a question for sequence 1630. Do we now capture all EBIS even if negative or inconclusive? Yes, that is the intent. For 1630, if an EBIS was performed, you're going to list it. Sequence 1875, lung cancer invasion of adjacent structures. If the path report includes not applicable, no adjacent structures present, can we enter none since there is not a not applicable option?
Yeah, here's 1875. There is, yeah, none. What do we say?
Yes, I think none is appropriate in that instance. If you want to send me a pathology report, if there's a specific patient that you're asking about that's causing you to question it, sending me the path report is probably going to be the most helpful tool.
Perfect. Thank you. And
Um, um,
I think Beth has another case. She has not yet submitted, but
oh, did I?
uh,
If you want to submit it, Beth, I'm actively reviewing cases ahead of the core group meeting on Friday, and if I can't answer it, I'll take it to the core group on Friday and get you an
yeah.
answer by the end of the day on Monday.
Yep. Thank you. Okay, I can take the next few questions. So Anna has a great question. When you say must watch all on-demand sessions to get education credit, does that only apply for our tracks that we signed up for, or absolutely all? So yes, it for your tracks that you signed up for. And one thing I just wanted to clarify, so out on the AQO platform, if you click on accreditation, when you log in, this will bring you to all of the information about the credits and receiving continuing education credit. So in order to receive a certificate, you must complete an online evaluation, and you must complete the evaluation at one time. You cannot leave and return to the place you last commented. So that's what I was referring to. So you will not receive credit for any session unless the online evaluation is completed. But again, that's just for the sessions or the tracks that you registered for. If you didn't register for adult cardiac, you don't have to, you wouldn't be expected to view that information for your CEUs if you just register for thoracic, just for that track that you registered for. I hope that clears it up. Sorry, Annie, I didn't mean to cause any confusion. Was it announced where AQO will be in 2023? So no, not yet. We do know that it was originally scheduled for Orlando. So that logistically is not going to work out for 2023. So when you submit your evaluations from this year's AQO, please, let it be known that if you'd like to meet in person, please continue to stress that. It was so great to see everyone in person this year, and the feedback that we got from those that were able to attend was overwhelmingly, they would love to continue to have AQO live in-person AQOs. It's really, again, it's so great to see everyone and be able to connect and network and just see everyone's faces. So when you do your evaluations for AQO 2022, please, comment that if you would like in person, ideas of where you would like it to be. We would love to get that feedback from you. So please just let us know. But we do not have an announcement yet on where 2023 AQO will be located. And I wrote this doing that one. So Aaron, we are working on surgeon worksheets. I know it just keeps getting pushed on Ruth and I's agenda on our schedule of things to get completed, but we're working on it. I promise. I've got some formatting to do on my end. So thank you. They're coming, I promise.
For Shakti's question, do you want to scroll up to 850?
Oh yeah, 850.
So 850 is, I believe, living status.
Yes.
And if you look under number 2, lives with family or friend, it includes those coming from correctional institutions, assuming that the inmate is able to care for themselves.
Yes. Where can we find how many CEUs are available for each track? So actually that is available out here on this accreditation page. So from the AQO platform, again, just click on accreditation. And if you scroll down, you can see how many CEUs are available for each track. Are the CEUs covered in our AQO fees, or are there additional costs? I don't believe. No, I don't think there's Carol. There's no additional cost.
There's no additional cost. It's covered in the fee that was paid for AQO.
Perfect. And will the credit be dated the day of AQO or November when it will be posted? That I don't know the answer to that question. Would that be for Core Excel, Carol, or do you think for Emily?
Let's see if it's can you scroll up? I don't know if it's on here or not, but let's see if it's listed on here anywhere.
Let's see. I think deliver your certificate. System. I don't see. Perhaps you should, I don't see it on here. Did I miss it?
I don't see it.
Yeah, I don't see it either. Kelly, I think the best thing to do would be just to email learn@coreexcel.com and they could possibly answer that question for you. I'm sorry, I don't have an answer for you. Last year, the date of the actual conference showed up on the CEU. Thank you. So assuming it will probably follow the same guidelines as last year. So again, the date of the actual conference showed up on the CEU. Thank you for that feedback. I don't see any additional questions. Let's see. There was one question from Maggie. I don't know if everyone saw that Sydney had answered. Does STS plan to use the transparency credit in any way, or is it strictly something to be used by US News? And Sydney had responded, again, I'm not sure if everyone saw, but the measures unique to US News and data published to the public reporting website. So again, if you have any questions about how they plan to use that measure, you'd have to contact US News directly via the methodology address that I had provided earlier. So I'll go back to it. Let me see. It was right here. So again, if you, well, that didn't work. If you have any questions about how they use it, US News plans to use the credit, please email them at bhmethodology@usnews.com. All right. And I don't see any additional questions. Oh, there's one. Well, please. A question refers to 1470, 1480. If a procedure has the same weight, which procedure would be considered the primary diagnosis? Would this be question by the surgeon?
The primary.
So let me get
I think they meant primary procedure.
Yeah, I think they meant primary procedure as well. And
Yep.
the primary procedure is going to be the sort of the largest portion of the case. So if you had a patient that had a lobectomy and a segmentectomy, your lobectomy is going to be assuming that it's different lobes of the lung, right? It would be the lobectomy would be your primary procedure. If you had a patient that had a segmentectomy followed by a lobectomy, then you wouldn't actually capture the segmentectomy with this code. You would use the concomitant procedure, which is the diagnostic resection followed by the anatomic lung resection. Even though maybe send me your specific example and I can help you work through it, Joseph. That might be the easiest.
Yeah.
I don't want to give too much overly general guidance and cause confusion.
Right. Good point, Ruth. Thank you. And he says he will do that.
Thank you.
Perfect. All right. And Dion, I might have to submit a FAQ, but if a doctor documents TXN to M0 to clinical staging for lung proceeds with a wedge lobectomy and it comes back T3, how should I code this? It shouldn't be coded for 1810. Ruth, I'm not sure if you're comfortable answering that one or if you'd like to.
You can submit it through the FAQ.
Yeah.
Thank you.
Yeah, it's so hard to answer them on the fly like this without having all of the information. It's just best we prefer to answer them, for Ruth answer them when she has all the information. She can look over it, read it, and then if necessary, we can bring it back. We just don't want to cause any confusion, like Ruth says, just by, providing kind of a generalized answer. So without having all the information. So we appreciate it. All right. I am not seeing any additional questions. To be respectful of everyone's time. Just a friendly reminder that we are expecting to have the AQO live sessions that recorded content on the platform by November 18th. And we will send a communication to all of our virtual attendees, as well as I think to all of our attendees, letting you know that that content is available out on the platform. With that being said, that's all that I have for today. That's all that I think that Ruth has for today. Again, if you have any questions, reach out to me directly. And if not, we'll see you guys on our next webinar schedule for our next monthly webinar schedule for December the 14th.